comes next. Republican Marshall Blackburn of Tennessee is a leading conservative voice and a leading advocate of repealing that new health care law. Debbie Wasserman Schultz of Florida is a member of the Democratic leadership team and calls the repeal effort both wrong and a waste of time. Congresswoman Blackburn, I want to go to you first because you've just come out of an important meeting with your Republican colleagues preparing for this transfer of power here in Washington. I want to get to some of the details in a moment, but I want you to assess for yourself and for the American people the significance. What do you think it means when John Boehner and the Republicans take that gavel from Nancy Pelosi and the Democrats?
What it means for the American people is that we're going to take action on what they told us they want us to take action on: the economy, jobs, repealing this health care bill, getting the American people back to work, and creating the environment where jobs growth can take place. And it will be a focus. You're going to see us united on that. We are hard at work on making good, on fulfilling what the American people want to see done. They have spoken loudly, and we are ready to go to work.
Well, let me ask you this question before I bring in your Democratic colleague. You know, you remember 2 years ago, most Republicans and even many Democrats who supported the health care overhaul said, my God, Mr. President, what are you doing? The American people care most about jobs and jobs and jobs and jobs. And I've talked privately to some of your Republican colleagues who cringe a bit, saying, yes, we promised to repeal health care, but why don't we wait a week or three and do some growth initiatives first?
Because small business in this country, and for the matter of fact, large and small employers are telling us this legislation, ObamaCare, is driving up the cost of insurance. It is something that is going to restrict access. It was poorly written, and the implementation on this is going to be very difficult. And you know, in addition to this, John, I have talked to so many of our state legislators, individuals from around the country, and they're going, do you all have any idea how expensive this is going to be to the states? Indeed, from my state, our Democrat governor, who is outgoing, wrote a book called Fresh Medicine that outlines a myriad of reasons of why you don't want to do this, why it is not health reform, and why it is important that we approach addressing health care delivery in a different way.
You're shaking your head as the Congresswoman speaks. Why does it matter to you as a Democrat, knowing I understand they made a campaign promise. We could have a debate about the timing of it. The Republicans made a campaign promise to do it. I have full understanding of why they would do it, but you know they can't succeed, that they can't get it through the Senate, and even if they could, the president has a veto pen, so why do you even care?
Well, because what we've been working on is trying to make sure we can continue this economic recovery. And what the Republicans are going to do by trying to repeal fruitlessly health care reform beginning tomorrow is potentially short-circuit that recovery. And what they're doing is they spent a lot of time during the campaign talking about job creation being a priority, turning the economy around being a priority, and yet tomorrow they'll take the first hypocritical step at going in the opposite direction, exploding the deficit, because healthcare reform cuts the deficit in the first 10 years by $143 billion, $1 trillion in the second 10 years. Right. What they're going to try to do is deny people coverage who have pre-existing conditions, prohibit people who are young adults from staying on their parents' insurance, increasing seniors' prescription drug costs. That's what they're going to spend countless hours of staff, member, and leadership time on, instead of focusing on creating jobs and turning the economy around. The opposite of what they said they would do.
Congresswoman, you're shaking your head. You're shaking your head, Congresswoman Blackburn, because you believe the health care bill increases costs, and I understand and I respect your position. However, hold on one second. I understand and respect your position. However, the official referee here. A lot of people sometimes disagree with referees, whether it's sports or Congress, but the official referee, the Congressional Budget Office, does say the health care law would have a positive impact on the deficit. I know you disagree, but can you change the referees in the middle of the game? If the Republicans are going to repeal this, should they put forward saying, we don't think we need this, but here are the trade-offs, here are the cost savings as we do this?
Well, for the record, CBO, 10 years of revenues for 6 years of expenses. That's how they get to that number, and that is not apples to apples. It is apples and oranges. So a little bit of budget trickery there. But here is what the American people want to see. They want to make certain that individuals have access to affordable health care. They want to make certain that we respect that doctor-patient relationship. They want to make certain that they are in charge of their health care decisions. They don't like a bureaucratic mishmash of all of these new agencies and rules and laws. That is not what they wanted. And whether it is a state legislator, whether it is our individual constituents, whether it is our employers in our districts, they are telling us that it was poorly written. It is going to be a nightmare. This is not what we want. Get it off the books. Let's start over and do things right. And, you know, I think it is really a wonderful expression from the American people that they are saying, we know that you all, Congress, that you can do better than